Have you ever had a conversation like this? I am concerned. A lot has been going on, and I cannot imagine what you're going through. I don't know how you're handling it. It is common for people to ask how you are, and sometimes it feels like a standard greeting, but people care. Maybe you don't want to talk about your thoughts, but your friends and family are there to listen. Maybe you can set aside 20 minutes before your plans, maybe 10 minutes before. It's okay to talk about it. We can talk about it. I am going to talk about it. I'm going to keep this phone number on the screen. I'm going to talk about death by suicide and how you can help. I'm Wanda Frazier, and this is Your Body and You. First, a couple of definitions. The CDC defines suicide as death caused by injuring oneself with the intent to die. The CDC relies on information placed on death certificates, and something to consider, death does not always show intent. So death certificates are filled in with the best information available. A suicide attempt is when someone shows any intent to end their life, but they do not die because of their actions. Data. Deaths by suicide are trending up. The latest finalized data we have comes from 2023 at 49,000 deaths by suicide. So one death every 11 minutes. As a comparison, there were 2 times more deaths by suicide than deaths by homicide in the same year. Except for the years we were seeing a high number of deaths by COVID-19, the death rates by suicide have trended up for the past 25 years. Preliminary data for 2024 and 2025 shows a similar trend. From the National Center for Labor Statistics, in 2024, suicide replaced COVID-19 as the number 10 cause of death in the United States. Suicide attempts are a little more difficult to track because of reporting issues. Most of the data shows 1.5 million attempted suicides annually. Demographics. Deaths by suicide affect every demographic in the United States. However, the CDC does not list children younger than 10 years old in a separate age group because the numbers are very low. But for consistency, they are included in the rest of their age-adjusted data. Western and Midwestern states suffer the highest rates of death by suicide. Rural areas suffer the most. So, Alaska, Montana, Wyoming, Idaho, New Mexico. In a little more detail, the CDC does list the causes of death by age group. In this image, deaths by suicide are shown in green. In 2023, suicide deaths were the second leading cause of death for people ages 10 to 34. For ages 35 to 44, it was the 4th leading cause of death. For ages 55 to 64, it was the 8th leading cause of death. Prevention. There is a lot of data published about risk factors and prevention for deaths by suicide. From what I can tell, there is no single life event, diagnosis, demographic, faith, family structure, community, history, or economic situation that will predict death by suicide. It can happen to anyone. It doesn't matter who you are. However, for family and friends, there are some warning signs. The first people to notice the signs are often family and friends, so your trusted circle. Here is the 988 Lifeline list of warning signs. The warning signs of death by suicide relate to what a person says and what they do, especially when these are different from the past 20 minutes, the past week. There is no defined timeline when someone decides and acts. If something feels like a red flag, it is worth getting involved. So, what can we do? What can we do? We can check on our friends and family members. We can keep communication channels open. We can ask clear questions. We can listen, with the assumption that we don't have to solve all problems. If it is safe, we can stay with them until they are connected to help. We can offer to call the 988 Lifeline. We can call 911 if the situation is unsafe. We can offer to take them to the emergency room. It is a complex issue. There are many resources available to help. Please call 911 in case of an emergency. Share or repost this video. If you are a survivor, feel free to include a semicolon in the comments in honor of Project Semicolon. Comment something useful because none of us have time for nonsense right now. Stay safe. This is Wanda Frazier with Your Body and You.